Now it's time for tip-episodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Welcome back, everyone, to this week's tip episode. I'm so excited to be here. I'm so excited that you're here. If you listened to the last one on how to have a quicker appointment, then this one is the natural next step. But if you have not listened to that one, it's a good idea to hit that little pause button, go back to last week, give it a listen, and then come back here because this is a continuation on the steps that we talked about last week. This week, we're going to be talking about scaling, oral cancer screening, and breaking down your op and notes. For scaling, I think my tips are pretty much the same that you've always heard, right? So things that your instructors might have told you, fellow coworkers might have told you. The funny thing is, though, when I look around, when I go into these offices and I see the people actually practicing, it's almost like everyone forgot. They kind of just go in all different directions. So be consistent at whatever pattern you scale in. If you are a top to bottom, left to right scaler, then always do that pattern. It's similar to probing. Pick a system and stick with it. On your tray, you should have at a minimum a universal curette, a distal posterior Gracie, a mesial posterior Gracie, and an anterior sickle. And if you think that you are efficient using only one or two instruments for the whole mouth, which I've had dozens of hygienists swear up and down and they get the whole mouth done with the posterior sickle, I would just say, think about what your instructors would tell you. Think about having them do a check. And if you really did get everything, because I'm sure that you did not. So get comfortable using the right tools for the right job. In the last episode, we talked a little bit about making sure that you have a perio setup and a prophy setup. I can't stress that enough because then you will have the right tools on your tray to do the right job. I personally am a big fan of doing the lower anteriors last because that always felt like the longest part for the majority of my patients. And it's always a good idea to set expectations with the patient. So I would say something like, hey, this up here on the top, it looks the healthiest. So I want to start here and then I'm going to end up on the lower front. It'll likely take me the longest time there, but I still expect all of us to be over in 20 minutes or whatever time frame that is the truth of what you'll be doing. I also always do the same pattern. I'm an upper right posterior on the buccal, wrap my way around, and then come back kind of on the lingual of the maxillary arch. It's almost exactly the same for me as what I do with the perio probe. I know a lot of the softwares you're able to kind of engineer which direction you're going to go, which quadrants, et cetera. And I take whatever I have for my perio chart path and I do the same thing. As much as reasonably achievable for myself. Now, again, that doesn't mean that that's what you have to do. I think it's just a great idea if you do. I think it's just a great idea if that's what you do. Then for the lowers, I do the lower right and then the lower left posteriors ending up on the lower anteriors, just like I promised the patient. And I think it's important to manage that patient expectation. And you have all seen the posts where the hygienist has said, hey, I got a complaint from the patient that I didn't spend enough time on the teeth. And I think because I don't really think that the hygienist missed those spots. I just think that the patient wasn't managed properly because we don't just not scale certain teeth. And so I think another good idea in this particular case is using your scaler as an explorer, especially for furcations and the fluted areas in the posterior. So making sure that one, you just didn't miss anything, but also that extra pressure is not painful. I don't want you guys putting a lot of pressure on the teeth, but just making sure you're exploring. And by doing so, you're displacing the gingiva. The patient definitely feels that they're going to remember it. And I think you'll have a lot less of those instances. So if you're a fast scaler, I would say let's use that as a tip that you could use. So I'm going to move on to the oral cancer screening. It's something I just learned today is that we're going to have a partnership soon with someone that's going to go over some oral cancer screenings. So I don't want to step all over that, but I will say this, as long as you or the dentist are doing it, then you are doing what is expected of your team. Just communicate with the doctor who's going to do this and document it that it gets completed. Be sure to take pictures, measurements of any suspicious areas. Make sure you have a referral source at your fingertips. So if that's extraoral dermatologist area, or if it's intraoral growths, I mean, it could be extraoral growth as well. Any abnormalities intraorally, I think needs to go to an oral surgeon and or a lab. So make sure you have all that figured out ahead of time. But again, we're going to go into oral cancer screenings at a later date. So let's move into the tray breakdown. I think the best tip for this one is that you, again, have a system. So having a system for your instruments, putting them back in the right places as you're using them. And if not exactly the right place every time while you're waiting for a doctor, or at some point, just make sure that that gets reorganized prior to the end of the appointment. It's super, super important. Don't just throw your instruments on the tray, right? So it's okay if it's in the wrong spot in the cassette. It's probably not as easy if it's just haphazardly thrown on the tray. So as you're done with the gauze, as you're done with the floss, the polish, whatever the disposable things are, make sure you throw them in the garbage. They should not be cluttering your tray or the tabletops. When your appointment is complete, it should really be as simple as closing your cassette, locking it, putting the lid on your tray, and getting it ready to take to the sterilization area. One thing I do with clean gloves and disinfecting wipes, I wipe down the seat first. I put my tray now on top of that where I just wipe down. And then the next step is to wipe down all the hoses and all the areas where the hoses touched, and put the hoses on top of the chair, kind of drape them over. I think that does a couple of different things. One, if you have anyone helping you in the office, which a lot of us do not, but it helps them understand where you're at in the process of disinfecting your room. If you've already wiped it and you put the cord back, then they don't know if there's been a first wipe done. And we should be doing 2 wipes every time. The first one is to remove all of the debris. The second one is for true disinfection. After everything has been wiped down, make sure you take your tray to the sterilization area. You come back to your room, put on new gloves, new disinfecting wipes, wipe down everything a second time, putting the hoses away where they go, remove your gloves, reapply the barriers as needed with clean hands, and reset up your tray. Get that system going. So it's wipe once, remove all the dirty stuff from the room, and then return and wipe again and reapply barriers. Once you get into that habit, it only takes just about a few minutes to get everything cleaned. But you have to be thinking ahead about throwing away all of your disposables and keeping your cassette as organized as possible. That really does help a lot. It's hard to train your brain to do that, but again, once you do it, you'll be very thankful you did. Now, notes. Notes is going to be the last thing I talk about today on this tip episode. Man, I just don't think I should be the person telling you about how to do your notes. I mentioned this in the last episode that I always got talked to about my notes because I'm not the person that's going to write paragraph upon paragraph upon paragraph about every appointment. And if in my offices we've had, a high production, go, go, go mentality, it's just not practical to do that. So I still maintain that you probably don't need as much information as a novel about your patients, but there are definitely things that have to be in there. And so in order to make sure that you're putting everything in there every time, you should create a template. Now, a lot of softwares already have templates pre-populated, but not any of them that I've ever seen has been adequate. You always have to add more information, more fields to fill in. Now, you can set up these templates so that the fields where you fill in are also pre-populated, but just making sure that you're actually updating that per patient every single time and not get lazy and just hit yes for everything kind of a situation. For these templates, I think some of the important things to have in there is, first of all, set it by appointment type. So if it's going to be a prophy, have a prophy template. If it's going to be SRP, have an SRP template. If it's going to be a peri-reval, have a peri-reval template. That's going to make it so much easier and more clear. And also later on, if you're scrolling through and you want to see kind of what appointments that person has come in for, it's so much easier to see, boom, they were here for a prophy last time. That's the template that we have. So within that particular template by the appropriate appointment type, you should have things listed like which procedures did you do? I think that it's very simple to assume that we've had a prophy and a prophy appointment, but it still needs to be documented in that template. I think a spot for gingival statements, make that very, very clear. Oral cancer screening, make sure it was completed, and also what your findings were. Were there any findings at all? Was it clear? You need to be very specific about what the result was, either good or bad. And caries risk that needs to be documented. I think if there's anesthetic, that needs to be documented as well. There's all sorts of other things that need to be documented. In the open field, that's usually at the bottom for anything else that you want to put in there. I think the important things are things that doctor mentioned to the patient that might be different than the norm. If there are any areas that they're watching, if there are anatomical variations that they noticed, specific techniques for prevention or whatever that they discussed specific for that patient needs to be documented. And be sure to document any questions that the patient also asked, and whether you or the doctor responded, what your answer was to that question. I think that that'll go a long way in preventing issues later on. You probably don't need to report that I used Crest toothpaste or I recommended Crest toothpaste or whatever for sensitivity. but just things that are very out of the ordinary, not generic, is what needs to go in there. And then I think the other thing to mention is that the notes may save or lose your career. I'm not trying to be scary here. It's just that in this day and age where people are just crazy and make absurd claims, you do need to protect yourself. So make sure you're as thorough as you need to be able to defend yourself and defend your work in a court of law. So I hope that this helps some of you out there build enough free time into your schedule that you can maybe get that drink of water or a chance to use the bathroom. If you have any thoughts or any additions, please let me know. Andrew at A Tale of Two Hygienists. Thank you so much for listening and have a great weekend, everybody.
A tale of two hygienists.